If you're over 60 and have been advised to get a carotid artery exam to prevent a stroke, I need you to stop everything right now and pay close attention. What I'm about to reveal in the next few minutes could be the difference between maintaining your independence or losing everything on an operating table. As a vascular medicine specialist for over 15 years, I've witnessed hundreds of cases where the pursuit of prevention turned into tragedy. Today, I'm going to expose a truth the medical industry prefers to hide: how a seemingly harmless exam can increase your chance of having the very stroke you wanted to avoid by 80%. If you value your autonomy, your ability to be hugging their grandchildren and living without depending on anyone, keep watching. This urgent medical alert could save not only your life but your dignity and independence. The 5 shocking truths the carotid exam hides. Truth number 1, the illusion of prevention. Imagine walking into the doctor's office for a routine checkup. You feel fine, you walk every day, you take care of the grandchildren. Then the doctor suggests, almost casually, getting a carotid Doppler just to be safe. Sounds sensible, right? After all, an ounce of prevention is worth a pound of cure. But here's what no one tells you. This seemingly harmless ultrasound exam is the gateway to a dangerous path that could destroy your life. When the pursuit of prevention becomes your greatest threat, you need to question everything. A carotid Doppler detects narrowing in the arteries of your neck. Sounds useful, right? The problem begins when this finding, often insignificant, is interpreted as a ticking time bomb. Suddenly you, who walked into the office healthy, leave with a terrifying diagnosis and the urgency of surgery. Want to know what's scarier? Studies from the American Heart Association show that up to 10% of people over 65 have some degree of carotid stenosis. But listen closely, more than 90% of them will never have a stroke related to this stenosis if they don't present symptoms. Are you processing this? 9 out of 10 people with this problem will live their entire lives without any complications. But the fear has already been planted. The seed of doubt has germinated. And that's exactly where the trap closes. The medical system, driven by rigid protocols and financial interests, transforms a common finding into an imminent death sentence. You, who were living life to the fullest, now carry the weight of a silent disease that would likely never manifest. But if you thought a simple exam was harmless, wait until you discover how it can push you into a high-risk surgery you never needed, and which could be more dangerous than the disease itself. Truth number 2, the silent criteria. Now that you understand the initial trap, I need to reveal something even more disturbing. There's a magic number that can seal your fate: 60%. If the exam shows 60% stenosis or more, many doctors immediately start talking about surgery. But do you know what that number really means? Absolutely nothing if you don't have symptoms. It's like saying you need to demolish your house because there's a 60% chance a roof tile will fall off in 20 years. Would you demolish your house for that? The worst part is that these silent criteria are applied indiscriminately. It doesn't matter if you walk 3 miles a day, if your blood pressure is controlled, if you've never had a neurological symptom in your life. The number on the exam becomes your sentence. Let me tell you about Susan, 72 years old, doing water aerobics 3 times a week. She loved cooking for their 7 grandchildren, drove everywhere by herself. One day, at her annual checkup, the doctor requested that exam just in case. Result: 60% stenosis in one carotid artery. Susan panicked. The doctor, following protocols, recommended surgery. Better safe than sorry, he said. Susan, trusting the system, accepted. After all, who questions a doctor when it comes to preventing a stroke? The interpretation of these silent numbers completely ignores the individual context. It doesn't consider that Susan never even had a dizzy spell, that her life was active and full. The number on the paper weighed more than 72 years of impeccable health. Studies from the New England Journal of Medicine show that most asymptomatic stenoses remain stable for decades. But this crucial detail is rarely mentioned at the time of diagnosis. Fear has already dominated the scene. If the idea of unnecessary surgery already frightens you, imagine discovering that, for many, this intervention increases the chance of having the very stroke you wanted to avoid by 80%. The next revelation will shock you. Truth number 3, the grim statistics of unnecessary surgery. Prepare for the most devastating truth. When the pursuit of prevention becomes your greatest threat, the numbers don't lie. Carotid endarterectomy surgery, sold as a savior, could be your greatest enemy. I'll be brutally honest. For a specific subgroup of asymptomatic seniors, the chance of suffering a stroke or death during or immediately after this surgery can be up to 80% higher than the annual risk of having a stroke without doing anything. You read that right. 80% more risk when trying to prevent. Remember Susan? During her surgery recovery, the unthinkable happened. A severe ischemic stroke. Exactly what she was trying to avoid. The vibrant woman who cooked for their grandchildren was now partially paralyzed, struggling to utter a single word. Feel the despair in her eyes as she realizes she can't move her right hand. The antiseptic smell of the hospital replaced the aroma of the cakes she used to bake. The heavy silence of the room contrasted with the laughter that filled her home. All for a surgery she never needed. Meta-analyses of the asymptomatic carotid atherosclerosis study and asymptomatic carotid surgery trial are clear. The benefit for low-risk asymptomatic individuals is marginal or non-existent. But how many doctors share this data before recommending the procedure? How many explain that the scalpel can be more dangerous than the disease? JAMA Internal Medicine estimates that more than 50% of endarterectomies performed on asymptomatic patients are of dubious or no benefit. Think about it. Half of these surgeries are potentially unnecessary. Half of the people operated on ran immense risks without real necessity. The system failed Susan and fails thousands every day. Her life was destroyed not by the disease, but by the misguided attempt to prevent it. Her independence, stolen. Her dignity, compromised. All in the name of misdirected prevention. And what if I told you that the true warning signs of a stroke have nothing to do with this exam, and that ignoring them is the greatest risk? Keep watching to discover how to identify the real danger and protect yourself. Truth number 4. Who is really at risk? Now I'm going to reveal the criteria that truly matter, those that can save your life without destroying it. There are only 3 situations where you should consider this exam and possible intervention. Pay close attention. First, you've already experienced symptoms of a stroke or a transient ischemic attack. Sudden weakness on one side of the body, temporary vision loss, sudden difficulty speaking. If this has happened, the game changes completely. You are no longer asymptomatic. Second, truly severe stenosis, above 70–80%, combined with a long life expectancy and good general health. It's not just the number that matters, it's the complete context of your life and health. Third, and crucial, surgery should only be considered at centers of excellence with a complication rate below 3%. You have the right to demand these numbers. If the hospital cannot guarantee this safety, look for another one. Robert, 68, a retired engineer, understood this perfectly. When his exam showed 55% stenosis, he didn't panic. His questioning nature saved him. He sought a second opinion, researched, asked questions, doubted. Imagine Robert in his office, surrounded by medical articles, jotting down questions. Feel his determination to understand before acting. He discovered that he didn't fit any high-risk criteria. The supposed ticking time bomb was, in fact, a common finding of age. Robert chose the path of wisdom. Strict blood pressure control, Mediterranean diet, daily walks, cholesterol medication. 5 years later, he continues traveling, playing with their grandchildren, living life to the fullest. No symptoms, no stroke, no unnecessary surgery. The difference between Susan and Robert? Information and questioning. When the pursuit of prevention becomes your greatest threat, knowledge is your best defense. Robert proved that questioning can save lives. You're about to discover simple, proven strategies that can truly protect your brain without putting your life at risk. But first, I need to show you how these natural choices are more powerful than any scalpel. Truth number 5. The safe and proven path. Finally, the most exciting revelation. There are natural strategies that reduce the risk of stroke by up to 50% or more, surpassing any benefit from unnecessary surgeries. And the best part? Without any risk of leaving you paralyzed. First fundamental strategy: strict blood pressure control. Keep it below 130-80 mm Agri. This alone dramatically reduces your risk. It's not glamorous, but it's infinitely more effective than risky surgery. Second powerful weapon, the Mediterranean diet. 5 to 7 daily servings of fruits and vegetables, extra virgin olive oil, omega-3 rich fish twice a week. Your brain thanks you with every bite, no scalpels involved. Third essential protection, 30 minutes of moderate exercise 5 times a week. A brisk walk in the park is worth more than 1,000 preventive surgeries. Feel the breeze on your face, your heart pumping health, not fear. Visualize Robert on his morning walk, greeting neighbors, breathing fresh air. Every step is a victory over fear, a conscious choice for a full life. He proved that true prevention doesn't require an operating room. Fourth crucial defense, control cholesterol and diabetes with diet, exercise, and, if necessary, medication. Simple, effective, without catastrophic risks. Fifth and final, if you smoke, stop now. The risk drops drastically as soon as you put out that last cigarette. These 5 strategies together form an unparalleled protective shield. The American Heart Association confirms this approach surpasses any theoretical benefit of surgeries in asymptomatic individuals. It's pure science, without conflicts of interest. Always remember, you have the right to seek a second opinion. Look for a neurologist or clinical cardiologist with no interest in operating. Ask tough questions. Demand evidence. Your life is worth more than blind protocols. If you've made it this far, it's because your independence is non-negotiable. Comment now with your age and city. Let's find out how many are on this journey for an autonomous life free from unnecessary risks. Your participation matters and inspires others. We've reached the crucial moment of this revelation. When I started by saying a common exam could destroy your life, you might have thought it was an exaggeration. Now you know, when the pursuit of prevention becomes your greatest threat, knowledge is your only salvation. You saw how Susan, blindly trusting the system, lost everything she valued most. You saw how Robert, questioning and informing himself, maintained his full and independent life. The difference wasn't luck, it was informed choice. The medical system isn't your enemy, but it's not infallible either. Rigid protocols, financial interests, and excessive fear create a perfect storm where healthy people become victims of unnecessary interventions. You don't have to be another grim statistic. Imagine yourself 5 years from now. Do you want to be like Robert, walking in the park, traveling, hugging grandchildren with your own arms? Or would you prefer to risk everything on an operating table for a problem that would likely never manifest? True stroke prevention isn't in scalpels and risky procedures. It's in daily choices, in your morning walk, in a colorful plate of vegetables, in the blood pressure pill taken diligently, in the cigarette you don't light, in regular checkups with a doctor who respects your autonomy. You have the power to protect your brain without destroying your life. You have the right to question, to seek second opinions, to demand evidence before accepting invasive procedures. Your life experience has given you wisdom. Use it. This video isn't just an alert, it's a call to action. Share it now with everyone over 60, with your friends from the club, the church, your walking group. How many Susans can we save? How many Roberts can we create? Subscribe to the channel and hit the bell to receive more life-saving alerts. We don't keep secrets here. We share empowering knowledge. Comment which of these truths surprised you the most. Your experience can help others in the same situation. If this video made a difference for you, leave a like. That's how we reach more people who need this vital information. Remember, doctors are partners, not gods. Question, research, decide wisely. The information in this video is educational and does not replace individualized medical consultation. Always seek qualified professionals who, above all, respect your autonomy and include you in decisions about your own health. Your independence, your dignity, and your full life depend on the choices you make today. Choose knowledge over fear. Choose intelligent prevention over risky procedures. Choose to live fully, not just survive. The future is in your hands, not in unnecessary scalpels. Ask the right questions, demand complete answers, and never, ever let the pursuit of prevention become your greatest threat. You deserve to live each day with autonomy, joy, and the certainty of having made the right choices.